All right, welcome to the third hour of the series for virtual simulation, no longer a novelty. What's next? This section will focus on diversity, equity, and inclusivity. I'm going to go ahead and introduce myself since I'm talking. I'm Dr. Elizabeth Robison. I'm at Northwest Florida State College in the Panhandle of Florida. And I'm presenting with two other individuals today, and I'll let them introduce them as well. I'm a simulation center coordinator at the associate degree program in a small program in Northwest Florida State College. Teresa?
I'm Teresa Cooney. I'm assistant professor at Howard Community College located in Columbia, Maryland. We have about 100 to 120 in our program, and I am faculty teaching in concept-based curriculum, and my area of expertise is pediatrics, though our course is merged with OB.
I'm Dr. Janine Berendt. I am the National Director of Clinical Innovation and Integration at Galen College of Nursing. Our undergraduate programs has an enrollment of about 8,000 students. We do have multiple campuses across the country, and our undergraduate programs include LPN to ADN, ADN, BSN, and then RN to BSN. And my area of expertise in higher education has been simulation since 2004. And then my clinical area of expertise is palliative care and geropsychiatry.
All right. Well, we're very glad to present today on this very important topic. So we'll go ahead and get started. So before we begin the discussion into DEI, let's have some framework, some concept statements. So we're on the same page when we look at DEI and cultural humility. And so we're going to take the information on DEI from the OADN statement for DEI. OADN seeks to promote diversity and inclusion in the nursing workforce to improve health equity for patients and communities. The OADN board developed its position paper on racial and social equity with bold action steps. Philosophically, they believe the journey to racial and social equity is a lifelong endeavor that unfolds through human connections and shared experiences. And each of us are privileged to teach and interact with learners. And with that, we have that shared experience. So we're continually evolving and appreciate the context and the needs for the learners along their journey. And so with that in mind, OADN appointed a diversity, equity, and inclusivity task force, which was charged with assessing the current state of the associate degree nursing education and proposing strategies for to improve diversity. And you may have seen the call for collection of information to provide your input for the research that is being led by OADN. And so we really want to make sure that this particular aspect, when we talk about virtual simulation, you can see how there may be concepts related to DEI within the virtual simulation component. The cultural humility piece, when we look at the concepts related to that, we are pulling from Dr. Ferranda's work, where she says in a multicultural world where power imbalances exist, cultural humility is a process of openness, self-awareness, being egoless, and incorporating self-reflection and critique after willingly interacting with diverse individuals. And that statement is included in our reference on Ferranda's work. So she has written on a variety of things regarding cultural humility and has a tool as well looking at cultural humility.
Now, virtual simulation has proven to be a very valid active learning strategy within nursing education. It's well documented in the literature. But now we're going to discuss ways that you can look at your curriculum and decide not only where would virtual simulation be most useful, but specifically how can you determine where there's a gap, such as DEI and including DEI into your curriculum. So just to take a step back, we've learned over the years that virtual simulation doesn't have to just be an assignment. It can be included in lecture. It can align with your course objectives, and there can be some pre-work and post-work done afterwards. We know we definitely have used it in the past for clinical replacement hours if a student misses clinical. And then most of us used it during lockdown, where that then became the clinical hours for our students to earn the hours needed to meet their state board requirements. So now that we're moving forward and it's no longer a novelty, and we realize that virtual simulation is here to stay, how do we figure out where do we place this so that it's very purposeful and meaningful? So it's you have to understand with your program, who is your governing agency, all right? Because it really is the accreditation agency that will direct your curriculum differently. For ADN programs, you have either ACEN or you have CNEA. And faculty needs to be aware which one they're in and then follow the guidelines. So using this, using these standards for ACEN or standard 1 in CNEA will then help you meet multiple objectives. So you can see here on the slides, we pulled the actual standards verbatim and placed them here on the slide for you to view at your leisure. So there's basically a couple of different types of nursing curriculum that we use in education. There's your traditional curriculum, there's concept-based, there is competency-based, and there's still some problem-based learning that's here in America. Let's focus on the two most common ones, which is traditional and a curriculum-based competency. With your traditional nursing curriculum, this is where learners move from simple to complex knowledge in a very specific area of study. Traditionally, it's primary acute care with some acute care, with some community settings, some public health settings, and long-term care settings. Traditionally, it's a lecture-based educational model where your clinical aligns with topics from classroom theory, and you have your very individual courses of pediatrics, maternal child, mental health, med-surg 1 and 2. With concept-based curriculum, we've learned that there's simply not enough hours in the day in an undergraduate program to compress all the possible information and present it to the students. And so there has been a shift in thinking on how can you get students away from memorizing these rote memorizations. And that's how the whole idea of concept-based curriculum has been adopted. Is where you focus on essential components for application, transfer, critical care, and critical judgment for providing patient-centered care across the lifespan. And it is traditionally more of an active learning versus traditional where the educator will speak to the students during lecture time. What's interesting enough is that this concept-based curriculum, for some of you who aren't aware, is really taking over across the country. And we're up to between 10 and 15 states that have pooled their resources with all the community colleges statewide, and they're sharing a single concept-based curriculum. And they're finding that this is working very well for the students as they progress through the curriculum. So for those of you who aren't aware of concept-based curriculum, it really is a fundamental different way of thinking. So we felt like we wanted to just give you a brief flow chart for you to kind of understand, because many of you may be in the middle of making that transitional change. So faculty actually develop and decide what are your categories of your concepts, and then I identify the key concepts in the curriculum. So for example, I'm going to talk about perfusion. So you have health and illness is your category concept, and then you have the concept of perfusion that will be taught across the lifespan. And so before the students ever learn about very specific diseases that are related to perfusion, they have to learn what are all the generalizations that you will see with this concept. For example, what are the risk factors that a patient can experience with a perfusion problem? Signs and symptoms, diagnostic tests, lab tests, interventions, evaluations, all of those generalizations. Then the nursing faculty will decide amongst their individual courses which exemplars for diseases will you then target to help teach the student. So for example, in one of our curriculum, we identified that for perfusion, these are just some of the exemplars we teach. We'll do cerebral vascular accident, we'll do heart failure, and we'll do congenital heart defects. And then those are done individual, they loop back to the generalizations, and then that's where we get into the whole nursing process, knowledge, skills, and it loops back to the outcomes. So interestingly enough, you would think that heart failure would be taught in MedSurg 1, but it's actually in our curriculum taught in pediatrics and maternal child, because in order to talk about congenital heart defects, you have to have the students have to have an understanding of heart failure. So this is just an example for you. And then we thought we'd line up the two curricular maps to give you an example of the normal progression. And if I just want to focus here on the concept-based model, you will have general courses. It'll be concepts 1, 2, 3, and 4, and embedded in there would encapsulate all the specialties. And this is something that has to be decided by the faculty. So you'll never have any two programs that are exactly alike. All right, so now that you have this understanding about how to choose where the gaps are in your curriculum, you know where to look up the curriculum standards from your accreditation agency. Let's switch focus and let's actually focus on how do you implement diversity and whole DEI.
All right, so let's look at the general things when we talk about the types of curriculum and where those curriculum gaps are. So when we're thinking about curriculum gaps, the three of us just kind of reflected as well on where we thought gaps were in our curriculum when we had the focus of DEI, and where it might be in other curriculum that we've talked with other instructors at conferences, through Zoom sessions, et cetera. So we really thought that some of the gaps may be related to initially gaps in faculty and student biases. So really giving that opportunity for faculty as well as students to look at their biases when it comes to DEI. Many times when we initially peeled back our curriculum, we did see that DEI was most often addressed in the theory portion of the curriculum, and really had little opportunities for clinical exposure. And it does depend on your geographic location, where you are at in terms of clinical sites. So it really, we saw limited opportunity for DEI in clinical settings. And we represent a variety of states where we come from, and no two states and really region within those states are the same in terms of exposure. So many of us in the simulation area have started looking at how can we incorporate high fidelity simulation mannequins, or you may have a different term you use, but use of face-to-face simulation within that component. Again, very little opportunity may be available as well, unless you have a larger simulation center or resources, as well as use of standardized patients that may be limited as well to larger programs that have that diversity within their area. So smaller programs like myself may have limited opportunities for including standardized patients within the program, specifically to expose students to aspects of how DEI may be used in clinical settings. So when we looked at the accreditation standards specifically that focuses on DI. If we look at ACEN standard 4.5, looks at how are we doing that in terms of our curriculum. And it really doesn't matter whether your curriculum is what kind of curriculum model that you're using, you still need to look at your curriculum in terms of cultural, ethnic, and social diverse concepts. How are you including those experiences within your curriculum from a regional, national, and global perspective, regardless of the curriculum that you're using? When we look at CNEA Standard 5, it talks about that experiential learning to enhance that student's ability and provides that culturally responsive care to the diverse population. So again, there's specific language in standards that focus on looking at diversity and equity and inclusivity. So when we took the charge of looking at how these virtual products focused on virtual simulation. So we're switching our gears now here. When we looked at the reviews of our products, we wanted to make sure that within our review that we looked at simulation design within the healthcare simulation standards of best practice. Now this term, our title may be somewhat unfamiliar to you. It initially was called NACSL Standards of Best Practice. So in 2021, September actually is the month, we saw that a change occurred where we had the 4th edition now, and that was provided in that initial first hour where we looked at the standards of best practice. So this is just kind of a reminder here that we now are looking at the standards in terms of simulation design for the criteria. So I'm going to kind of go over a little bit more detail with this. Let me switch my screen here. All right, so here's the healthcare simulation standards of best practice. It's a free resource with an ACEN. You can link, you don't have to be a member. And within the different standards, you have a variety of standards that have different names here: professional development, pre-briefing. The focus for us for the OADN virtual simulation reviews is the standard related to design. And so I kind of moved towards that standard. You can click the link, it's free again. And when you click that, it then brings up that updated standard with design. And what changed primarily with this standard with the update in 2021 from 2016 really had to do with the refocusing on the one standing out, which has to do with simulation-based experiences should be designed in consultation. So that previously was embedded, now that's the standalone. There was 11 criterion in 2016, and there's 11 criterion today as well. So when we look at the changes here, it didn't change in terms of the numbers, but it changed in terms of how those numbers were represented. All right. So let's look at specifically within that simulation design piece of it, how we are bringing out diversity concepts within that particular simulation design standard. Criterion 7 says facilitators should incorporate evidence-based components of cultural diversity. So you can see the specific language that is being threaded out in terms of design, focusing on the importance of cultural diversity. Likewise, facilitators need to be mindful of the learner's diverse cultural differences, values, and responsibilities when they're designing a simulation, so during that design phase. So it's very important to incorporate those concepts of diversity within that aspect. Other portions of the design standard also bring out aspects of DEI, and not necessarily with that language, but things you need to look at in terms of including making sure that when you build a simulation-based experience that aligns to the modality, that the modality aligns with the objectives. And that's very important when we looked at virtual simulation products, that the modality was virtual simulation, that the objectives within that product for that simulation aligned with that modality. So you can see here, designing the scenario, again, to provide a case activity and context for that experience. We wanted to make sure that if we are looking at virtual simulation that include DEI concepts, that it provides that context with the perception of realism, and if we checked yes in that particular area. And one of the other aspects, number 7, is making sure that learner-centered facilitative approach with those objectives and bringing out that information in terms of the learner's level of knowledge. Kind of going back to that discussion of what we had, is making sure that the learners understand their biases, but when you're designing the simulation or you're using a product that's already designed for you, how are you bringing that information within your curriculum? So Janine's going to be talking about the virtual product itself.
Thank you. Yes, we're going to talk a little bit about how we can use this collaborative product from OADN and Unbound Medicine to build a simulation experience that aligns with the healthcare standards of best practice that Dr. Robison just gave us an overview of, as well as uses resources that have been vetted by experts on our review team. So while we talk about this, Dr. Robison is going to share her screen, and we're going to go on a little virtual field trip to the OADN VSR platform. So according to the standards of best practice, we've already identified that there's a gap in our curriculum where our students are having limited experiences with diverse individuals, particularly gender diverse or individuals with sexual orientation that is different from our students. So with that in mind, you can come to the virtual simulation review platform, and in the search bar, you can enter any one of those terms. So sexual orientation or gender identity. And so when the results come up, you can see right away that there's one SOGI nursing review. So on this platform, then, when you click this link, you'll see the review that our review team has conducted on this product. And in the series, the second section of this series, you'll get to see a very in-depth review of the virtual simulation reviews, what our templates look like, what the components are that we review, as well as some really nice tips and tricks for how you can best use this product, including why to create an account and how to flag those scenarios that you know you're going to use repeatedly. So in our curriculum, we can't control whether or not our students are going to have the opportunity to engage with or provide care to gender diverse individuals. So here, the SOGI product is a free product. We put that up front and center because that's often it's usually a huge deciding factor whether or not you're going to use a product is cost. So this one in particular is free. It targets learners across all of the nursing education spectrum. One of the ways that I use this is for faculty training, because if faculty are going to be teaching nursing care of gender diverse individuals, then it's important that the faculty be familiar with their own biases. What is noteworthy about this particular one, and we're going to get into this a little bit more when we talk about the scenarios, is that it's actually a toolkit that you can download. It can be integrated into Canvas, and so you can assign modules. You'll see that there are various scenarios and modules that come as a toolkit. So this is the actual SOGI site, and you can create an account here and download their product as a SCORM file for Canvas, or you can just access it online and use links within that. So here you can see on our review, if you scroll down, we searched for sexual orientation, and it's highlighted there in yellow. It discusses the cost, whether or not there's a demo available, which in this case didn't apply because anyone can log on and use it. It's a free product. As far as the equipment, the only thing that's required is internet access and a web browser. It does work with and without special software, so that would be where the SCORM files to import into Canvas come into play. And then the rest of the review addresses that this product is in alignment with the standards of best practice for healthcare simulation.
Okay, so my college actually did do the download. We happened to use Blackboard, and so we downloaded the SCORM into our LMS, and it's pretty easy regardless of which LMS you're using. It just shows it a little bit differently on the user end of it. So we, in our program, we have used this product as part of a DNP project, which I'm on the committee for one of our faculty who is going through her DNP program. And so this is really our first semester using this particular product and from a research perspective, and seeing how we can incorporate it based on the findings of her research, how we can best then incorporate this within our program. So it does meet that intent of the simulation design standard when you look at piloting, even though she's not really calling it a pilot because she's doing an active project with this. The data we get from this is really giving us an opportunity to see how best to use this type of product within our curriculum to fill those gaps that we see in our community in terms of student exposure. So again, we saw this regular site here. So I'm going to go ahead and go to open up the product and give you a chance to look at how the product looks once you download it from SCORM. Let me make sure you'll see it on my screen. All right, so this is how it looks when you do the download. And you can see here, there are 4 lessons within this product. The first lesson really is considering your biases. So we talked about that in terms of our gaps as well. So it runs through a series of informational sessions. A lot of it is really looking at doing that survey, a different type of survey, our tool, looking at cultural humility and the self-reflection yourself. And then you actually go into scenarios. And that's what, as a review team, we looked at, is looking at the different scenarios and looking at this product. And that's how we developed our review along with the simulation design. So it's got lesson 2 is Wolfgang's story, 3 is Cody's story, 4 is Sarah's story, and then lesson 5 is Connor's story. So let me kind of go over the aspect of 2 of those within the product here when we look at the story, and give you a little bit of approach, and then I'll turn it over to Teresa to kind of go over the other aspects. So you are briefly familiar with this product through this short webinar here, but you can actually go and explore this in more detail, which I think is real important if you're going to incorporate it in your curriculum, that you as faculty really look at this product and see aspects of this product and whether it will work for you. So you can see, I'm going to just bring up Wolfgang's story here. And so with Wolfgang's story, and this is the layout for all of the products, is it provides the learning outcomes, And then along with, again, I'm using the term outcomes because that's what's used in this particular product. You may see these as objectives and have a larger outcome within your program of incorporating DEI scenarios within your program. And then you may see these as objectives here versus outcome. It's just in terms of semantics on how you use that. But each of the scenarios have things for the students to be able to obtain at the end of using this particular module. And so that's important when we look at simulation design, the outcomes and objectives are incorporated and that they align with your curriculum. You're not just using a product that doesn't align with your curriculum. The other, Wolfgang happens to be an older gay man who lives alone. He has weight loss and low mood, and he's grieving for the loss of a partner of 30 years. So it talks about coping, and he's not sure how to go on without that partner. So it gives you a little bit of this backstory here in that front information of the scenario. When we look at the other scenarios as well, when we go to Cody, Cody's information here is a 16-year-old. And he's a transgender. And so he's got some different learning outcomes and gives you that information about what he's going through. And he's actually coming into the emergency department. So you can see the different settings of where individuals may come into. Wolfgang is coming into a clinic. Cody's coming into the emergency room. So when I look at, I'm going to just kind of briefly go over the information after you get to the outcomes piece of it. Now you go to the rubric. And so the rubric is each scenario has a rubric that you self-identify ahead of time on where you think you are in terms of your understanding as a learner. And it's preset to novice. And if I just kind of go through that and click that, it's how I'm just going through it, not really reading it, but I'm identifying myself as a novice when it comes to this particular content here, and it allows me to then see what my responses were with that particular aspect of it. And so if I go back to Wolfgang's story here and I go to this particular area here, now I'm actually getting into the simulation itself. And it talks a little bit how the game works here, accessibility statement, and then you can actually enter the name, the student can enter the name, reiterates those learning outcomes again, and the summary of that information. And now it goes right into the scenario here.
Hello, Mr. Coomer. May I call you Wolfgang?
Yes, you can call me Wolf.
Hi, my name is Jane, and I'm your nurse today. I see from your triage note that you came here today due to recent weight loss and some increased fatigue over the last few months.
That is right, but I had a number of changes.
Can you tell me a little bit more about these changes?
A couple of months ago, my friend died. He was enough of my friend.
So now this is how this game works. It gives you some choices that you can actually pick. And if I'll just pick one that I've been through this one a variety of times. So I'm going to give you one that I know is an incorrect response. Okay.
Oh, so when you said the love, you mean, so like you're queer? I didn't realize.
I don't like that word. It is offensive to me.
So you can see here, then it gives the learner feedback on why that is not the correct response. Likewise, if you have a correct response, it also gives the learner feedback. So when we decided to use this product as part of the research study, we actually made sure we went through all the incorrect choices as well and was very aware of the feedback that was given to our learners from an incorrect aspect of it. So now we're going to go and have Teresa kind of go over some of the other scenarios here. Because, for timing purposes, we're not going to go through each of these products here.
So we'll just look at the shell of Sarah That's the number 3 in the list of 4. And Sarah is a 19-year-old queer female, and she presents to an outpatient clinic for primary care for an intake appointment. And so the nurse practitioner is doing the interview and the assessment. So there's that option if it meets your needs in the curriculum. We anticipate in our program, we would place this one under the concept of sexuality. All right, and then the one we do want to demonstrate is Connor's story. He's number 4 of the 4 available. And Connor is a 37-year-old transgender man who uses the pronouns him and he. He has not officially changed his name, so the health record and insurance still has his name as Kate Zaechuk. And he comes to the clinic today due to a 3-week history of cough and increased shortness of breath. So let's go ahead and open up this one. Just so we can see what some wrong answers look like and what some right answers, because he gets very frustrated because people keep calling him Kate, even though he's been very specific that his name is Connor.
Hello, Kate. I'm Jen, the nurse practitioner.
My name is Connor. I've gone through this with the receptionist. Did she not tell me? Because my birth name was Kate, but I go by Connor.
All right, and so these are the options that you have. You can request the patient to calm down, acknowledge his distress, ask why the patient is seeking care today. So why don't we, let's choose ask the patient to calm down.
Try to calm down.
I should calm down. How am I supposed to trust you if you can't even get my name right?
I think this is very realistic, right? Okay, so we did not validate his distress and it interfered with starting that nurse-patient trust. All right, go back to our options. And then why don't we go ahead and click the right answer, acknowledge his distress.
I'm sorry, yes, I see there's a note that we're going to correct your chart.
Thank you.
All right, and let's keep going. Let's see what the next question is. How should the nurse practitioner proceed? Should you clarify the pronouns and transition status? Should we ask the patient why they're seeking care today, or should we use the patient's legal names? So why don't we pick the wrong answer and ask why he's seeking care today?
Okay, so why are you here today?
All right, let's pick the right answer. And let's request, clarify his pronouns.
Okay, Connor, my pronouns are she and her. What are yours?
He and him.
And do you identify as transgender, non-binary, or something else?
No, I'm a trans man.
Okay, so Connor, can you also tell me why you're here today?
I think you can get the idea. This later unfolds to using the right anatomical terms comfortable with, doing an actual health assessment and finding out why he's sick.
Okay, there are other simulation products as well besides SOGI that you can search in the virtual simulation reviews, that if you want to look at some other opportunities for products, some of the, another free product is through the Montgomery College. It has the a scenario with the postpartum hemorrhage where a woman gave birth to the wife. There's also some areas too that there's scenarios where they have trans and gender non-conforming patients in terms of patient care. We also looked at Sentinel U. There's a variety of ethnic and diverse patient pool scenarios within that product. Shadow Health, even though it wasn't available at the time that the task force looked at this particular virtual product, under Tanner, there's in the advanced pharmacology module, there is one that supports a diversity product with this particular module. And with these Sentinel U and Shadow Health are paid products. And with these paid products, you're going to see a variety of updates from the time that the team actually did the review. So they're constantly updating and adding different scenarios to their products as well. Montgomery College is pretty much stable here in terms of not adding, it's the free product. So we've already gone over SOGI. So now we're going to take a look at how the team looked at placement of the SOGI product within the curriculum. And I'll turn that over to Teresa initially to identify how that could be done in a concept-based curriculum.
Okay. So when we looked at the two basic curriculums here, we got to remember your simulation should always align towards your student learning outcomes and your end of program student learning outcomes. And so on the left, we place the scenarios. There's also the examine biases and cultural humility, which is at the very beginning, and then the 4 patient scenarios. And then if you look at traditional, we felt that fundamentals or med-surg would be the best place to introduce how do you examine your biases and what is cultural humility, because it is different than cultural competency. And then we felt that Wolfgang was best placed in mental health, Cody in pediatrics, Sarah in maternal child, and then Connor could either be fundamentals if you're working on assessment or actually in med-surg 1. But it's different when you go to a concept-based curriculum. You have to look at all the concepts that the faculty has chosen. And in this situation, you're examining biases and cultural humility, which really has to come first before you even open up the simulations, would either fall under professionalism, or it could even fall under your concept for advocacy, for patient advocacy. So that would have to be a conversation with the faculty as where you want to place the beginning steps. Then using Wolfgang's simulation story, it could either go into grief and loss, or it could go into mood and affect. And in our current program, my current program, grief and loss is in 3 different semesters, and mood and affect is in the 3rd semester only. Cody's story, which is the pediatric patient, you would think would go somewhere in pediatrics, but it really wouldn't. It would go under stress and coping, which in our curriculum is actually under mental health. Sarah's story would be well placed under the concept of sexuality, which is introduced in the pediatric maternal child concept space class number 3. And then Connor's story, he probably, with that scenario, would be best placed probably in health assessment, which would be in the 1st semester, or what traditionally would be called fundamentals. So these are some examples of how you can lay out SOGI across the curriculum. So there's that thread of DEI throughout. So we do challenge you to think about your current curriculum and think about what would that look like? Where are the possible placements? And see if you can start an open conversation with your colleagues.
Okay, we have come to the end of this particular 3rd hour here, and I know we've thrown a lot at you. Those resources are available that we use for this, as well as the entire workshop session. We placed the references under a single QR code that you can access it, and that would incorporate all the different hour presentations under this virtual simulation what's next presentation. So we again hope that you enjoyed our little brief view into how to incorporate DEI using virtual simulation within the curriculum, exposed a variety of different types of models, the traditional versus concept-based curriculum, reintroduced you to the virtual simulation reviews and how you can highlight and bring out different products that you might be able to incorporate within your own curriculum. We did a little more highlight of a free product because many of you are similar to what is occurring within our own program. Funding is limited. And so when you can have access to a free product that meets your needs within the curriculum and supports your end of program student learning outcomes, it always helps with administration to be able to look at incorporating that product within your own curriculum. Any last minute things, Teresa and Janine?
The only thing I'd like to just point out is the whole SOGI, sexual orientation, gender identity. We're at the forefront of it right now in healthcare as we talk about our inequities. And we're finding that it makes sense that you have to start with faculty and educate faculty, examine your biases and start changing the way that you're thinking to have uncomfortable conversations and bring it forward to your students to then be able to teach them how they're going to act and behave in a clinical setting and then using these scenarios. So the three of us in our conversations have talked about how in our curriculums, that's our first launching point, is educating the faculty first before jumping in and then teaching and helping facilitate this with our students. So thank you very much for spending time with us. We hope that you're able to bring something forward from our talk today.
All right, thank you.
Thank you.